Hello. Thank you for joining me today as I guide you through my change proposal for an ambulatory services line that I developed in my Healthcare Management and Leadership course. In 2015, I worked for a healthcare organization in the quality department. The healthcare organization contained 207 care clinics in the Pacific Northwest. In addition, it is also a nonprofit organization that is highly focused on meeting standards of care and reducing healthcare spending. Unfortunately, sometimes even with the right intentions, implementing change within an organization can be difficult. I have identified a project that was initially met with a high level of resistance. By the end of this presentation, I will propose a recommendation so that the organization is better prepared in the future. To help set the tone of this presentation, I would like to start with a quote by Charles Darwin. "It is not the strongest of the species that survives, nor the most intelligent of the species. It is the one that is the most adaptable to change." I have created an outline that will help assist you in navigation after this presentation is complete. We will begin by first reviewing the problem identification and discussion, followed by the problem analysis, understanding resistance to change, quantitative evidence to support this, qualitative evidence to support the change recommendation, and references. While working with the quality department, we routinely worked with many different departments, which included risk, regional clinic managers, and other key stakeholders. We met with the intention to improve and continue quality patient care in an efficient way. Creating standardization in workflow while maintaining best practice standards were the main focus of these meetings. The issue I identified is the high level of implementation resistance when trying to standardize medication storage and disbursement. The impact on the organization was high due to the clinic dependence on having medication and ensuring that the new WAC was followed. The policy was created by the Department of Health and listed in the Washington Administrative Code, also known as the WAC, and detailed in RCW 7442-260. Next is problem analysis. The identified problem of implementation resistance occurred because of the following issues. Initial lack of understanding by employees by the reason of change and where it originated from. Communication breakdown between departments, administration, and clinics. Changes were hard to implement and were seen as threatening as it involved cost changes, supply changes, and process change. Blaming and interference due to political agendas and status occurred, stemming into very negative behaviors. Stakeholders, being unaware and uninvolved, did not take it seriously. This created a high priority problem and can be seen as a radically innovative change for the healthcare organization. It is highly significant due to the extensive fines, financial loss, and dependency of medication in the clinics. Quantitative evidence. In order to evaluate the ambulatory clinic's adherence and status of how medication was currently being stored, data first needed to be collected. Observations were performed on all clinics with medications to obtain measurable data. Specifically, types of medications being utilized, how it was stored, such as if it needed refrigeration, and if it was kept in the correct temperature. If it was securely locked in a cabinet. Once the data was collected, goals were set to provide the clinics with ways to improve and decrease fees associated with the mishandling of medication and the amount of wasted medication due to improper storage. Qualitative evidence. It was important to also ensure that qualitative evidence was gathered. Training was provided to educate the managers on how to train staff and provide a transparent platform. In an effort to implement successfully, training sessions were scheduled to support managers and employees by detailing how to utilize standardized documentation process of medication that would be subject to being scored. This would also provide evidence of improvement. While this reduced the cost and created clear lines of accountability, many employees thought the daily logs were a waste of time and medication counts initially showed a lot of variance. The training sessions were also not mandatory and not all employees received the same message. Understanding resistance to change. Learning how to navigate through resistance to change and adapt to new methods seemed to always be a struggle. The organization did not deliver the information consistently and lacked in providing employees with transparent goals and objectives that they were trying to reach. The changes being made to the medication handling was not to interrupt the employee's workflow, but to adhere to a statewide mandate and reduce spending. In addition to workflow interruptions, managers and senior executives were not understanding the WAC in the same manner, and therefore the project continued to display resistance. Kurt Lewin was born in Germany in 1890 and can be seen as the father of social psychology. He wanted to reach beyond the mere description of group life and investigate the conditions and forces which bring about change or resist it. In 1947, Lewin introduced his model of change as the force field analysis. By addressing the employees' resistance, the organization could have been better prepared to address issues that may have changed their outlook and caused them to react more positively. Things like money in a way of a bonus for improving initial scores, authority being improved by title changing and giving the employee a title such as a super user, status improvements such as being included in the development, and better working conditions by reducing the employee's workload. I have included an example of Lewin's force field analysis, which includes the driving forces such as policy directions, clinical and social, consumer demands, being the patient and their medications, political and environmental external sources, cost pressures, and new research and practices, followed by the resisting forces, which are organizational culture, internal politics, poor leadership, communication systems, fear of change, and change fatigue. Since these items had been identified and driving forces outweighed the resisting forces, implementing change more positively could have occurred. Readiness for change. Readiness for change can be explained as the organization's members' shared determination to implement a change and shared belief in their collective capability to do so. There are 5 ways an organization can prepare their employees for readiness. Initially, the healthcare organization was not ready for change and did not review their readiness prior. In fact, the employees were most likely facing burnout and initiative fatigue due to so many changes that were already facing outside of medication storage and handling change. So again, there are 5 ways an organization can prepare their employees for readiness. 1, by creating a clear message of why the change is needed. 2, demonstrate why the change is the right change. Ensuring that the employees have and are confident in their skills. Confirming that leaders visually support the change and are collaborating together. And 5, explain how the change will benefit the employee. Once these are in alignment, it will be much more productive when initiating change. Change recommendations. My recommendation is to hire an organizational development professional to assist in future projects and utilize Lewin's 3-step process for implementing change and its assumptions. Healthcare organizations are always evolving and going through a multitude of transformations. Based on the complexity and potential barriers, that's why I feel that the organizational development professional will be the best person to assist and implement these 3-step processes. This way, leaders and employees have access to a professional who has the specific skill set needed to be successful. This will also help managers increase their employees' readiness to change. The first step would be unfreezing. An example of this would be providing the data in the form of the WAC associated to the medication storage and reduce costs and cost pressures the organization is under. Next is changing, which is the inclusion of employees in the moving component where the employee is involved in policy revisions and workflow designs. An example here would be the employee helping to create the new workflow and policy to support the medication storage. And finally, refreezing, ensuring that the new policy and workflow is being adhered by performing audits that can be compared to initial findings and seeing proof of the newly desired outcome, followed by the positive reinforcement that employees have agreed upon and that is significant enough to motivate them to change. And finally, creating a successful implementation of the change recommendations. In order to be successful, the organization will need to commit to the 5 interactive elements that were identified in the text and the Pursuing Perfection program, which are a strong impetus to change. In this case, the external regulatory requirements from the DOH. Leadership commitment to quality. Managers would need to ensure that the employees are following the new workflow by providing the employees with proper resources and reinforcing them in a way of mandatory trainings and internal clinical audits. Improvement initiatives. By engaging all employees in the clinic and ensuring all hierarchical levels are in alignment and open to improved workflows. Alignment to achieve consistency of organizational goals, such as staying in alignment with the organization's mission, vision, and values. In doing so, this will keep the organization in a good position with a strategic plan. Integrated to bridge goals and steer away from department silos. This ensures that the new workflow is not only captured and adhered to, but can effectively be seen throughout the system. An example would be the medication is recorded in a log, can be ordered and tracked with the supply department, and be given to a patient and noted in the electronic medical record for further reference. Finally, I'd like to thank you for taking the time to review the identified problem and being adaptive towards the recommendation I provided. The last slide will be that of the references used to build this presentation. Thank you so much.